everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode I'm going to be talking about a very important topic that I think all breast cancer patients deserve to know, which is why is it so important to regain your shoulder range of motion after you've had breast cancer surgery. So remember guys, if you like this video, please hit the subscribe button. It is completely free and it really helps me make more of these videos, and it also helps get the word out to more breast cancer survivors. So if you want to help out the next lady or man coming after you who's been diagnosed with breast cancer, hit that big subscribe button and help out your friends and people coming after you. Okay, so why is it so important to restore your shoulder range of motion after breast cancer surgery? I'm going to give you my top 6 reasons as to why this is a very, very important thing to do. The first one is that if you are moving straight from surgery through to radiation, whether you've had a lumpectomy or a mastectomy, one of the reasons it's important to get your shoulder moving again is because the position that is demanded in radiation sessions is essentially this. Now you don't have to be completely here, but you've got to be pretty darn close to it. So as you can imagine, if you come out of breast cancer surgery and your shoulder is a little bit stuck, you're here, you might have some cording going on, you might have scar tissue that's really tight, you might just have a sore shoulder, you might have had a pre-existing shoulder condition before breast cancer was diagnosed, but ultimately if you're moving straight from surgery through to radiation, then this is one of the primary reasons that you want to get your shoulder range of motion restored after surgery. So one of the most important people in your team is going to become your physiotherapist, because ultimately they're going to be the person that helps you get your shoulder moving through a variety of exercises or manual therapy like massage, joint mobilization, lots of different treatment techniques. So what I want you to consider is what is coming up in your treatment regime, because if radiation is coming straight after surgery, in difference to, say, if someone's going from surgery through to chemotherapy, or if they're having, for whatever reason, they're going straight to radiation after surgery, then we really need to make sure that your shoulder is moving. The problem with a shoulder that is even moderately stiff going into radiation is that the majority of the time when patients get radiation, they're up for anywhere from 3 to 6 weeks of radiation, which is a daily appointment for those weeks. And most of the time the patients are in this position for up to 15 minutes. So even if you can sort of get your shoulder here when you're starting radiation, as you can imagine, the more appointments go by, the more time that ticks over, the more weeks and days that you're having this done for 15 minutes at a time repetitively. I often see patients who are going into radiation with a stiff-ish shoulder come out with a much worse shoulder after their radiation. This is one of the primary problems whereby which I believe breast cancer patients can be at higher risk of shoulder bursitis. So if anybody wants to check out what shoulder bursitis is and why I believe it affects a lot of breast cancer patients, I have done another video called Why Does My Shoulder Hurt? So you can go and have a look at that video if you would like to find out more information on shoulder bursitis, which is a very common condition in shoulder, in the shoulders of breast cancer survivors. And it certainly involves a fair amount of discomfort. So go and check that video out if you're not sure what shoulder bursitis is and whether you might have it or not. The second reason it's really important to regain your shoulder range of motion after breast cancer surgery is that so you can perform functional activities. Now this might not sound like much, but it's amazing how often you use a body part and you don't realize how much you use that body part until it's injured or restricted. So I'm talking anything from your ability to go back to your sport or certain styles of exercise you might do, like yoga as an example. If you've got a really stiff shoulder or restricted shoulder, your ability to perform a lot of poses in a yoga class might be quite affected. If you're playing netball, if you're doing any sort of sport that requires a little bit of range of motion at the shoulder joint, you could be a bit surprised if you haven't restored that movement after surgery. The other obvious thing that impacts people's functional activity is just the ability to do household chores, and that might be anything from cleaning a window to putting something up in an overhead shelf, because that sort of stuff is what makes up our everyday lives. And I know it's a little bit of a boring topic, and I'm sure everyone would write off household chores if they could, but it is something that we need to be able to do on a functional level every day. There's even issues by which people will go away on holidays and not be able to join in certain activities that they'd really like to do because their shoulder range of motion is restricted. And that might be a game of tennis or just doing anything on a holiday, like swimming, by which your shoulder is really limiting you from joining in that activity. So again, get to your physiotherapist if you've got any sort of restriction in your shoulder after breast cancer surgery so they can start getting it moving again. The third reason it's really important to get your shoulder moving after breast cancer surgery is lymphedema prevention. Now, the reason lymphedema can be, I believe, triggered by a loss of range of motion at the shoulder is because if you look at your lymphatic system, it relies heavily on muscle contraction, movement, and a bit of gravity to help flush that fluid through. So if you cut an artery, it will spurt blood because the arterial system has the heart pumping behind it. So it's got a lot of pressure in that system. Compare that to the lymphatic system. You cut a lymphatic vessel, it will trickle. So it has no major pump behind the system if you compare it to the arterial system. So what it does rely heavily on is muscle contraction to get the lymph fluid moving. So consider that as part of looking at lymphedema prevention, I look at the person's ability to move their shoulder. So if someone's got a really stiff shoulder, I am conscious of the fact that this could impact their lymphatic flow. So consider that shoulder range of motion is also a necessity to regain in the context of lymphedema prevention. Similarly, if someone's got existing lymphedema, what's one of the treatment techniques we often advise you to do? Elevation of the shoulder, because once your arm is in this position, lymphatic fluid can drain back down the arm with the assistance of gravity. So if you can't even get your arm very high, you're going to be limited in certain treatment options. So consider shoulder range of motion in the prevention and management of lymphedema. The fourth reason I like people to consider focusing on getting their shoulder range of motion back after breast cancer surgery is that so they can regain their full strength. So what I mean here is if you can do everything below shoulder height, but there's certain movements, particularly lifting your arm overhead, which you're really limited in because of whatever reason, whether it's scar tissue, whether it's musculoskeletal tension, that ultimately means you cannot strengthen your arm into, say, this position as an example, which means ultimately there's a large aspect of the shoulder that is weak. So weakness leads to tension, tension leads to weakness, and those two things combined generally lead to pain. So one of the best reasons to restore your shoulder range of motion after breast cancer surgery is that so you're able to do things like a shoulder press or a lat pull down in a gym, or push against a resistance band, lift a dumbbell, whatever you like, because again, that turns back into the other point I was referring to earlier, which is the ability to do functional activities during the day. And so if you can't regain the strength in your shoulder, it's going to impact your daily life. Even if you're not necessarily a gym person, this can be where lack of strength can still impact your day-to-day life. So consider that restricted shoulder range of motion is, in the long term, certainly going to impact your ability to be strong through that body part. The fifth reason that it's important to restore your range of motion in your shoulder after breast cancer surgery is pain relief. Now, I just quickly mentioned in the point before that if you are lacking range of motion, then essentially there's a tension issue. The longer tension persists for in the tissues, the weaker the tissues tend to get. The more weakness and the more tension, ultimately that leads to one thing, which is pain. So I certainly see a lot of people after breast cancer surgery with a sore shoulder because it's just tight. And the most common area that shoulders get tight in is the back of the shoulder blade. Now, I have done another video that I'll just put a little card to up here, which is improving your range of motion. I think it's part 1, but I'll make sure I get the right video up there for you guys. And it involves using a tennis ball to massage this little pocket behind your shoulder blade. One of the best things you can do though, again, if you've got a tight shoulder after breast cancer surgery, is go and see a physiotherapist who has some experience with treating patients who've gone through breast cancer treatment if possible. You can even go and see a massage therapist if they're aware of the precautions they've got to take around treating patients with breast cancer, and get them to do manual therapy on your shoulder to help get your arm moving again. This is a really, really important point, guys, because I think the muscular tension that can build up in a shoulder after breast cancer surgery is incredibly normal, meaning it's a really typical aftermath of breast cancer surgery that we tend to develop tension. The most common areas of tension in the shoulder after breast cancer, like I said, it's behind the shoulder blade, but it's also through the pectoralis muscles. There's other muscles that can get tight, like the upper trapezius, and ultimately it can cause, restricted range of motion in the shoulder, but it can ultimately then also cause pain. And the more pains we can get off your plate as the breast cancer survivor, that is a really, really good thing. The 6th reason we want to restore shoulder range of motion after breast cancer surgery is to reduce your risk of cording. Now, I've done about 3 different videos on cording, but if you're not sure what cording is, I'll put my first video up here to cording, which is how to resolve cording after breast cancer. Cording is essentially nerve tension that I believe starts following axillary lymph node dissection or sentinel node biopsy. So anytime there's surgery being done in the axilla, I find people are generally at risk of cording. And the stiffer the shoulder range of motion, the higher the risk of cording, I find. So again, if someone has got full range of motion in their shoulder in the early weeks after their breast cancer surgery, generally I will find that their risk of cording is less than the person who's got a tight, restricted shoulder range of motion. Now, cording at the end of the day is just nerve tension. But one of the reasons we want to get your shoulder moving is not just so the joints mobile and the soft tissues mobile and the muscles are getting stretched, it's also so that the nerve tissue is getting stretched. Because every time you lift your arm up, you're not just stretching muscles, you're stretching nerve tissue as well. So if we have cording as a risk factor with lymph node removal, then one of the best ways to try and reduce your chances of cording really hitting you hard is to get that shoulder range of motion going as soon as possible. Again, I think there's lots of good exercises that you can do after breast cancer surgery that can get you started, and I have done another video on range of motion exercises after breast cancer surgery that you can go and check out if you have just been through surgery. But at the end of the day, there are still some people who, despite having a really good range of motion in their shoulder, they might still get a little bit of cording. But I find that the better the range of motion in your shoulder, the easier it is to treat the cording. So just keep that in mind, guys, that we are also trying to prevent cording as much as we're trying to prevent lymphedema when we are restoring range of motion in the shoulder after breast cancer surgery. Thank you so much for watching this video, guys. I hope you've gained some really good information about the importance of restoring shoulder range of motion after breast cancer surgery. If you have any questions on this topic, please leave a comment in the section below. I'd love to hear from you and find out what other topics around breast cancer you'd like more information on. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.